EQT Partners has been making moves in the US. The Swedish-based private equity firm recently made its first large-cap exit, selling Press Ganey to Erez and Leonard Green. Yesterday, EQT's Eric Liu sat down with Bloomberg Deals reporter Nabila Ahmed to discuss the transaction.
As we own our companies, we check in every 6-12 months to determine how far are we on that value creation path and whether the timing is right. And for Press Ganey specifically, we looked up at the beginning of this year, looked at the original value creation plan, looked at what we had accomplished, and determined now is a good time to do a market check.
And this is a business that allows hospitals to survey their patients about the quality of service and that kind of thing. Can you tell us a little bit about sort of the digitization of healthcare and how this fits into that pattern?
Yeah, so the funny thing about the company is I would say when the company was originally founded, it was originally a patient survey company. So they did surveys to patients to see how their experience was. But even before we owned the company actually broadened its product offering, and we kept doing that. So they collect a ton of data on patient experience in the hospital setting. They also collect quality data, safety data, and also workforce engagement data. And one of the things that we help the company do is really determine some of the correlations between those different data sets to help hospitals drive better insights into how to manage their businesses better. And one of the things that Press Ganey is very proud of is that Press Ganey customers have better financial performance, operational performance, as well as clinical outcomes relative to non-Press Ganey customers.
You do have another healthcare business in the US. It's called Certara. It's a pharmaceutical technology business. What are your plans with that?
Yeah, so Certara is an investment we made 2 years ago in August of 2017. And it's a really unique company. They actually are the market leader in biosimulation modeling for pharmaceutical companies. So instead of running a human clinical trial and testing it in a bunch of patients, a control and a treatment arm, they actually have detailed models on how drugs work in the human body, how the human body works. And they can simulate how a trial would work, and that data can be accepted by FDA in certain indications in lieu of actually running a human clinical trial. And the number of indications for which the FDA is willing to accept that type of data has just been growing over time.
And what about a sale plan for this company?
Now that one's still quite new, so that's not in the horizon. There's a ton of value creation that we still foresee in that company.
And in terms of future investment in healthcare, where are you looking?
Yeah, so the two sectors that we like within healthcare are healthcare data companies and healthcare product companies. And the reasons that we like those sectors are, one, that's where we have a ton of experience as a firm, and we've made quite significant investments in the past. Secondly, we like those business models. And third, we have a network of advisors within those two subsectors that we think can help us add value in a differential way relative to other potential buyers.
Why has this been such a great time for deal making in that healthcare data space? We've seen a number of deals in the past year.
Yeah, I think it's really the convergence. I think healthcare, there's a steady baseline of deals, I would say, in that sector. There's a number of firms that are quite experienced and active and successful in that sector. And when you combine that with kind of data-based business models, which have been a very good source of private equity deal flow, when you have healthcare and IT in the same deal, that's been quite popular amongst both private equity as well as strategics.
And EQT has been in the US for about 10 years now. Could you tell us about how the opportunities have evolved in this market over that period of time? And where are you seeing the biggest growth opportunities right now?
Yeah, so for us as a firm, when we originally launched in the US, we actually started with an infrastructure fund, which is a separate investment category. It wasn't until 2014 and 15 timeframe that we actually took our large cap buyout fund into the US. And so we started with the healthcare sector. So Press Ganey and Certara are the first two investments from that fund. And now we're moving to the TMT sector as well as the business services sector.
And in terms of your competition in this market, who do you see yourselves competing with? We've seen this trend of a lot of investment firms partnering with their LPs to co-invest for deals. Do you see them as a bit of a competition?
Yeah, it's funny. I would say, sort of 5 or 6 years ago, you started seeing some of our more sophisticated LPs starting to hire in-house teams. You'd occasionally see one or the two of them compete directly for deals. But I think more recently what you found is that a lot of the large sophisticated LPs are looking to do more active co-investments with GPs. I think GPs like us and other firms have just a variety of tools that the LPs don't have today, and so it's more convenient for them or it's more, I guess, value enhancing for them in their respective constituencies to just invest alongside the GPs.
On that point, let me finish by asking you, there is so much money to be deployed by private equity companies at the moment. Are there enough deals to go around?
It's funny, as much money as there is in private equity, if you look at the spectrum of equity, if you look at private equity relative to public equity, it's still a very, very small fraction of the overall kind of ownership style for companies. And so I think we see a lot of continued opportunity for private equity.